Good afternoon, everyone. Just to break the awkward silence, we're gonna give a few minutes here to let folks trickle in, but it's wonderful to see the participant number kind of stroll in and see how many folks are joining us today. So thank you all. All right. I'm gonna go ahead and get started. I know folks are gonna continue coming in, but just to make sure we get all of the voices that we have to feature here today and to share their expertise and experiences, we're going to go ahead and get started. So first of all, good afternoon. My name is Michael Corral, and I'm here representing UCLA Center for the Transformation of Schools. And I just want to start by saying thank you all for being here. We have folks here today from when we looked at the registration, K-12 districts. We have county offices of ed from across the state. We have state agencies, including Department of Public Health. We've got the Department of Ed. We've got folks from different youth justice organizations, higher ed institutions, other nonprofit and advocacy orgs, and then we even have some behavioral health providers. So it's just amazing to have all of that energy, all of that experience, all of that expertise here in the room today. And this wide range of voices and all the sectors coming together really represent one simple truth, that student behavior, discipline practices, and mental health, they don't sit in separate silos of here's education and here's health. If we want responses that are restorative, aligned with best behavioral health practices, and that are actually meaningful and practical for young people, it takes genuine, authentic, tangible alignment and collaboration across sectors. So for that reason, I want to take a moment right now to thank our partners at the California Health and Human Services for co-sponsoring this event and helping bring all of these cross-sector voices into the same space. And I'm also extremely grateful for the Child and Youth Behavioral Health Initiative, acronym CYBHI, and the Office of Youth and Community Restoration for their partnership in making all of this work possible. And then thank you as well to my work home, the UCLA School of Education and Information Studies, to my colleague, Adriana Jaramillo Castillo, who you'll hear from shortly, and then to our additional panelists that are going to join us later on, Dr. Michael Massa and Dr. Kathy Doe. And then, of course, so much of this, why we're here today, wasn't a deliverable that anybody was responsible for. It was just people wanting to come together, cross sectors, took the time out of their already busy workloads to do this. You all are taking the time out of your busy work days to be here. And so there's so many that are just behind the scenes right now that I'm extremely thankful for. The response to this conversation has been strong, to say the least. Just to give some insight, I think the last number was there was over 460 people registered. And I don't say that to like feel proud. I say that because it tells us something real, that there's a tension between discipline, belonging, and behavioral health that it's not abstract and it's not disconnected. And it's showing up in systems across the state. And that is why this conversation matters here today. And then before I go to this next slide, I do want to leave a note. There is an option for questions to be asked. I don't know where that's going to pop up, but we do want to make sure that you all know as the conversation goes, you'll have a option to add questions. And then a lot of you that are registered today also added questions earlier in your registration. Extremely grateful for the time you took to do that, and we'll try to incorporate those throughout the conversation today. Okay, next slide, please. So today's webinar is titled Where Discipline Meets Behavioral Health. And that title, we kicked around some different ideas, but it's extremely intentional. These two worlds, education and behavioral health, they haven't always been and the same, speaking the same language. And then frankly, our young people and our school systems and our health systems have been the ones to pay the price for that gap. So the purpose of today, it's not to debate whether discipline matters. It does. We're not here to suggest that behavior in schools isn't real. We heard that in your feedback for registration. Like it is real. We're have educators, leaders, we're having challenges right now. But what we are here to do is look honestly at what the data shows, hear from people doing this work on the ground, and then leave with some tangible tools to use. And we have an extraordinary group with us today. We've got clinicians, researchers, practitioners, all people who carry scars and then also help from years of working in our systems, myself included. And then now I'm going to pass it over to Dr. Sohail Sood from CYBHI to walk you through our agenda and what to expect. So Dr. Sood, over to you.
Thank you so much, Dr. Corral. It's a pleasure and an honor to be with you all today. Uh, Looking forward to this conversation. I just think it's incredibly important. Dr. Corral and I will actually be going through the science of these topics of what discipline looks like in schools and the data around it. And then I'll be going a little bit deeper into the health outcomes that we see with children and youth who face exclusionary disciplinary practices. Following that, we will engage in a great conversation and bring in a few other amazing experts into the space, including experts in neuroscience and psychology and juvenile justice. So looking forward to bringing them up here. And then close with a broader question and answer period. So excited about all that. We'll also, apologize for forgetting this, we'll have the opportunity to hear from a school district directly and get a better understanding of how they are using school counselors and implementing various measures to really address some of the issues at the core of what our children and youth face. So looking forward to that conversation. And with that, I believe I'm passing back to you, Dr. Kodal.
Thank you, Dr. Sood. So let's get into it. I want to start where I think we have to start with what's actually happening in California schools when it comes to student discipline, not the policy aspirations, like what is actually happening. Because understanding that gap and those disparities between intent and implementation is really the foundation for everything else we're going to discuss today. So let's start with a basic question. What actually happens when we suspend a student? Thinking of this specifically in academics kind of state of mind. We often think of suspensions, and I'm a previous classroom educator, school building leader, as a brief pause, right? It's like a timeout. The student steps away, we give the classroom some harmony, some ability to reconvene and learn, right? That's what we think we're doing. And then the student, after being away, comes back ready to learn. Like that's the mental model for so many years we've been working on. But the evidence tells a vastly different story. Research consistently associates suspensions and exclusion with lower academic growth, a reduced sense of belonging, higher dropout rates, increased involvement in the juvenile justice system, and even a single suspension is associated with meaningful consequences. And those consequences compound, right? They don't lead to a positive outcome. And then here's the part that often gets missed in these conversations. This isn't just an academic issue, and Dr. Sood will speak to this. It's a health issue. Students who experience exclusion show higher rates of stress, their trauma responses are altered, and long-term mental health impacts. So we're going to hear more about that from Dr. Sood in a few minutes, but I want you to hold this framing. Suspension is not a neutral intervention. It doesn't fix for others or fix for both. It carries a heavy burden, and that cost shows up in a child's sense of self, their body, their future, their families, their communities, and not just their transcript and not just the days they missed on their student information records. Next slide, please. Policy context. Our state has actually done quite a bit on the policy side. Over the past decade, the state enacted major discipline reforms, most notably a phased ban over the years on suspensions for the category of willful defiance. And that term covered things like dress code violations, talking back. It was a subjective category. Obviously, it wasn't used for one dress code violation. It was like, okay, Michael, you've done this 10 times. It's time to take a break. And what that data has showed was that this concept was applied very unevenly. And so the legislation has said, let's stop suspending kids for minor discretionary behaviors. And on paper, that has worked. The category dropped dramatically. And we can see this on this next slide here. But here's where it gets complicated. And this is where my colleague Luis and I spend a lot of time. And honestly, this is part of the data that we find most disheartening, but also signals the loudest, like what needs to happen. Let's go to the next slide, please. When we look at the full picture, willful defiance suspension have come down. And hopefully you can see that. If not, willful defiance is that red downward trending line. But then when we look at the other categories, next slide, please. So here we've highlighted the other categories of suspension. We kind of see this upward trend. So they've either held steady or they're starting to climb. And then when we think about what's in the background of that, next slide, please. Suspensions overall have dipped briefly, but now they're starting to come back up. And so this begs the question, are we just replacing that category? And then we cannot look at this data honestly without naming what bodies, what identities, what communities, what student groups are most affected. Students in foster care are suspended at 4 times the average rate. We see persistent, well-documented disparities for Native students, Black students, and students with disabilities. These patterns are not random. They reflect systemic group decisions about whose behavior gets labeled as a problem and whose gets supported and provided with interventions aside from suspensions. So I'm going to pause there and hand it to Dr. Su to deepen the behavioral health lens on everything that was just described. So Dr. Su.
Thanks so much, Dr. Corral, again. So in addition to the role that I have as director of California's Children and Youth Behavioral Health Initiative, I am a practicing pediatrician. I take care of kids in hospitals, working this weekend, and when I'm there, I'll see kids with asthma. I'll see kids with seizures. I'll see newborns being born. I'll see kids with skin and soft tissue infections. And I also see the many manifestations of stress. That headache or that abdominal pain that gets IV medication sometimes, CT scans other times, that ends up not having a diagnosis really with any true anatomical pathology that originates from the neck down. We'll see substance use issues, sometimes have to transfer kids to intensive care units for management of these different types of conditions. And I don't want to see that anymore. I think if we call these conditions preventable, let's prevent that. And so just really excited to spend some time talking about that overlap with some of the concepts and important policy decisions and approaches that we take when it comes to disciplinary practices in schools, as Dr. Kodal has mentioned. But let's jump to the next slide. I love science and numbers and data, so I'm gonna spend a little bit of time going through that. There have been so many studies conducted over across the past several decades that really point to the associations that are shown here on the screen, right? Sometimes we gloss over it, but each study is done a little bit differently. Overall here, this is a systematic review of 19 different studies on the concept of punitive school discipline, and that's defined differently. Generally speaking, we're talking about exclusionary disciplinary practices like suspensions and expulsions. But overall, you can see that those types of practices are associated in a given individual with an increased risk for, and I'm going to read these, death by suicide, persistent depressive symptoms, depression, drug use disorder in adulthood, borderline personality disorder, antisocial behavior, physical injuries, trichomoniasis, pregnancy in adolescence, tobacco use, and smoking experimentation, right? And just to underscore a few of those, if we take a look at the study that was done on the correlations related to death by suicide, this was done by looking at more than 100 young people who died by suicide in the New York area, and looking backwards at their lives and seeing who experienced an exclusionary disciplinary practice in school, so who was suspended or expelled, and then comparing those people to people who might otherwise be similar, right? Talking about same community, same age, same income level, same demography of any sort. And overall, the findings were very clear that there was an increased risk or increased association between death by suicide and those who experienced those school disciplinary practices. Drug use in adulthood, same type of study. This one was done by more than 1,000 individuals in Illinois. And actually, this is a study that looked at followed families for generations. So looked at children in first grade and then followed them through adulthood. And around the time of adolescence, they asked those young people, and they even asked their parents, how many times have you been suspended from school in the last 3 years? Is it zero? Is it a few times? Is it many times? And then 15 years later, ask those same people, are you using any illicit substances? And found, again, when you compare it to those who are otherwise from the same community, same income, same race, same demography, there's a higher risk of drug use in adulthood among those who were suspended or expelled in school. Trichomoniasis, also known as trick, it's a sexually transmitted disease, causes pain and discharge, pregnancy complications. Young adults who had trick and then looked backwards, those who experienced suspensions or expulsions had nearly 3 times higher odds of getting the sexually transmitted disease than those who did not experience those types of disciplinary practices. So overall, I think what I just want to emphasize is that the takeaway is that these associations are very strong and really quite robust. But if you jump to the next slide, none of these studies is really going to be able to determine whether there was something about these kids, like something about their behavior, that made them more prone to risky behavior, such that they encounter the health outcomes that I just mentioned, which is what got them suspended in the first place, or the other way around, whether the suspension, the expulsion, that type of practice pushed them into spaces, either physically or mentally, where they were just more prone to engage in risky behaviors. And what I would say to that degree of uncertainty is what you see on the screen. I'm just not sure if it's the right question to ask. I think we can go in circles if we do that. And if you jump to the next slide, because the bottom line here is that services help. They help kids who've experienced suspensions and expulsions, and they have kids who haven't experienced suspensions or expulsions, but may be at risk for it. Right. So this is another study that showed there's a clear inverse association, meaning that these protective factors you see on the right here at the individual level, having extracurricular youth developmental opportunities, at the interpersonal level, having connectedness with friends and family, at the school level area, where you have an adult at school that you feel comfortable talking to, that you feel safe at school. Having these protects you against these types of more concerning health outcomes. So one last slide. I promise this is the last one. If you go to the next slide here, this is a study that happened in Minnesota looking at 8th, 9th, and 11th graders, and looked again, basically screened everybody for a very common depression screening tool, and looked at those who had experienced exclusionary discipline within the past month and looked at those who did not. And you can see here on this slide, those who were suspended or expelled in the past month had a higher chance of basically screening positive for depression than those who didn't. But if you go to the next line, that risk was really buffered and mitigated. So it improved for everybody if they had an adult at school that they felt like they could talk to. So it the bottom line here, I think no one is beyond reproach, right? There need to be consequences for actions, just as Dr. Corral mentioned, but also no one is beyond reach. And that we can really help our young people growing up in society with services and with supports to ensure that they're part of a community, that they're part of a beautiful collective that we call California. So if you go to the next slide, uh, that's really what I spend most of my time doing these days, is through the Children and Youth Behavioral Health Initiative, California is trying to really transform the way we support children, youth, and families. And this is through the expansion of services for young people and their families to really meet them where their lives are lived. So a lot of work happening in healthcare, a lot of work happening in the digital space, a lot of work happening in homes and communities, and a lot of work happening in schools. Uh, Thank you, Luis, for putting some links in the chat. These are great places to go to learn more about all of these aspects. What I'll say is, on the school side in particular, those three bullets, bringing wellness into the classroom is about social and emotional learning, right? Understanding these frameworks of how we can build this concept of resilience from a concept to a skill set and making sure that young people can really benefit and gain and know how to take care of themselves. Nurturing a supportive campus culture is about training up high school peers to support other peers. There's great examples of that working. And so we're working with many high schools throughout the state to scale that type of practice and to share out best practices. Also, training programs for all adults on a school campus to learn how to have a healing-centered approach to understand the biology of stress. And then expanding access to school-linked care services. That is really about centering schools as a place where care can be delivered and trying out new financing mechanisms to link schools to the healthcare financing system such that the Kaisers, the Aetnas, the Blue Shields of the world can basically pay into a sustainable model to ensure that services for their members, right, who we all pay health insurance to get care, to make sure that their members are getting the care that they need in a place where they spend a lot of time, which is schools. So I could talk about that topic for hours, but with that, just as a little bit of background, I will pass back to Dr. Corral.
Thank you, Dr. Sood. And then, so that was really the clinical behavioral health lens. And so now when we ask the question, what does that look like in the school system? What supports and conditions are necessary for that? What we're seeing with a growing body of districts that we're working with specifically, but also beyond the districts that we're even working with, is that schools are doing this restorative implementation, not as a standalone program, but they're really intentional about weaving it into existing frameworks like many of you all that are in school systems right now are using with MTSS and PBIS. So what does that actually look like? Well, it looks like schools they're honestly just really trying to build human connection and community. It's not, there's a lot of books, there's a lot of frameworks, but at the end of the day, at the root of it is building genuine relationships with young people and adults and adults and other adults. And I'll add this last piece. I know a lot of the feedback we got with questions is how do you use restorative practices? How do you implement restorative practices when it feels like so much chaos is going on? It's hard for students to learn. It's hard for teachers to teach. And we're just letting kids off the hook. And where I would push back is that restorative practices are built around accountability. Think about how difficult it is to have a conversation where you're able to admit your wrongs, apologize, and figure out the plan to fix this situation. That is so much more difficult than sending a young person home or having a young person excluded from their peers. Next slide. And I'm going to go through this really high level because I do want to get to my colleague Adriana's piece here. But what are these action steps from an individual lens? So for everyone here today, regardless of whether you're in a school building, in a health system with behavioral health clinician or a community partner, the first call to action is ongoing learning and shared responsibility. So it really just means staying curious and informed. Understand where this data lives, like what's happening, what students are being left out the most, what student groups are experiencing the worst disparities in outcomes. Second is continuous improvement through transparent data. Public data with our school systems is available. It's out there for your community school where you send your child, where your grandchildren go, where your nieces and nephews. That data is available. It's important that we know where that lives. It can't just be a hidden piece that you see every once in a while in a news clip or a report. And then third is school community and family engagement. It's so critical for all of us working in these systems to bring students, families, and the rest of our staff and community into ongoing dialogue about discipline policies and practices. So with that, I want to hand it to my CTS colleague, Adriana Jaramillo Castillo, who's going to share a case study from Livingston Unified School District.
Thank you, Michael, for the intro. Good afternoon, everyone. Today we'll be exploring how the Livingston Union School District transforms student support through strategic counseling via our case study that was released earlier last year. Next slide. So to preface, Livingston Union is a rural Central Valley district in California, serving a student population that is predominantly Latina, socioeconomically disadvantaged, and English language learners. Post-pandemic, Livingston Union faced significant challenges, including a sharp spike in chronic absenteeism rates and rising student mental health concerns. This is where we spoke with district leaders, including the lead counselor and superintendent, where they identified that robust access to counseling could serve as a crucial equity lever, directly impacting student attendance and sense of belonging. This critical realization by the both of them led the district to adopt the American School Counselor Association, ASCA national model. Also, Livingston strategically invested their local control funding formula, LCFF funds, to implement the national model with 3 key objectives. The first, to lower student to counselor ratios from the California state average of about 446 students to every 1 counselor, down to the national model recommended 250 students to every 1 counselor by ensuring at least 1 full-time counselor is positioned per school site. Second, to protect and clarify counselor roles, making sure that counselors have been dedicating over 80% of their time to direct and indirect student services, thereby shifting away from purely administrative tasks. And third, by anchoring their model to research-based practices, Livingston Union adopted a data-driven approach to planning and aligning counseling goals with measurable improvements in attendance and school climate outcomes. If we can move on to the next slide, please. Okay, so let's now look at the tangible effects of Livingston Union's strategic approach on student outcomes and mental health. So in regards to chronic absenteeism, Livingston Union experienced a significant post-pandemic surge, with rates rising from 4.9% in 2019 to a peak of about 18.3% in 2023. So this increase disproportionately affected English language learners, Latinx students, students with disabilities, and low-income students. Livingston Union school counselors responded to this issue by using attendance recovery, not as a district compliance measure, but as a relational and preventative approach. They implemented both virtual and physical relationship-based check-ins, student group meetings, family collaborations, and targeted referrals to school and community resources. These efforts led to a significant reduction in chronic absenteeism, decreasing the rate to a 14.2% by spring 2024. So in terms of school climate and sense of belonging, despite national post-pandemic declines, 89% of Livingston Union students reported a sense of belonging. However, about 21 to 22% of students still reported persistent sadness, with notable gender, racial, and ethnic disparities. As we see, the shift to virtual learning during the pandemic presented unique challenges for maintaining student connections. And this is where we see that Livingston Union actually successfully enhanced its school climate and strengthened student connections by integrating its comprehensive counseling model with a multi-tiered system of supports, or MTSS framework. They utilized district-wide social emotional learning curriculum, specifically second step tier 1 classroom level support, with counselors focusing on tier 2 and 3 targeted interventions. Counselors also maintained engagement through virtual forums, games, direct outreach, and essential services like grief support and food drives during remote learning. So from what we have seen in Livingston Union, what does this mean for student health in schooling? And so the case study underscores several critical points, being that sustained investment, not just short-term grants, is actually vital to the long-term sustainability of comprehensive programs. Fidelity to a research-based framework like the national model ensures program effectiveness and impact from district level to site level and promotes consistent communication across educational infrastructure. And then also clear role protection for counselors is paramount, as we have seen in the case study, allowing them to focus on direct student services. So the call to action ultimately is that counseling functions as a proactive as well as a preventative mental health infrastructure, which is directly linked to improve attendance and student belonging. To ensure the continuous positive impact and sustainability of counseling as an effective resource, it is essential to regularly audit student-to-counselor ratios and time allocation, integrate counseling goals into the school's local accountability plans and MTSS planning. And then lastly, cohesively monitor attendance rates, reform punitive disciplinary measures, and disaggregate school climate data. And that's all I have for you all. Thank you so much.
Thank you, Adriana, and for everyone here today. We tasked Adriana with the impossible goal of trying to present this powerful example within 5 minutes. So I really do encourage you all. My colleague Luis had put the link to the report and the case study in the chat to look at that and understand how Livingston is a powerful example of what happens when a district decides to invest in connection and then actually puts the structure and data behind it. Because it's one thing to say and kind of message that we want stronger connections, stronger relationships with our young people, with our community, but then not put anything there to actually fulfill that mission. Okay, so building on that example, we're now going to transition to a broader conversation. We've invited a panel of experts who approach this work from different vantage points, and kind of continuing on with this this approach of cross-sector collaboration. This conversation is going to bring so much fruitful information for all of us, myself especially included. And so I want to briefly introduce them before we open the discussion. You've met Dr. Sood. He is a hospital-based pediatrician and director of the California's Children and Youth Behavioral Health Initiative. His work focuses on advancing statewide strategies that integrate behavioral health, education, and community-based supports to improve access, belonging, and outcomes for young people. Dr. Michael Massa leads health policy work with California's Office of Youth and Community Restoration. He brings deep expertise in juvenile justice, school reentry, and how restorative approaches can support accountability and healing for system-impacted youth. And that's going to be, for those of you in the education sector and system, this is going to be very meaningful and powerful to hear some of Dr. Massa's work. And then Dr. Kathy Doe, who is an education researcher at UCLA, whose work examines how adolescent brain development and social context shape learning and decision-making, with a focus on translating neuroscience into more equitable education, policy, and practices. So we're going to move through some questions here. Our goal is to get through these panel of questions and then save some time at the last 15 minutes for the panelists that are able to stay around for some Q&A from all of you on the call. All right, so this is going to be our first question here. It's for Dr. Sood. What's one misconception schools still hold about their relationship between student behavior and behavioral health? And then why does it matter in practice? And then there's a second piece to that. When exclusionary discipline is used, what impacts on student well-being do you see the data alone doesn't fully capture?
Yeah, a lot of parts to the question. I appreciate the topic. I should also note to the audience, I apologize. I do need to unfortunately leave this conversation right around 4 o'clock. So I'll be here for as long as I can until then. Let me start, I guess, just by acknowledging I can't imagine a tougher job than being an educator. It is, there's a lot coming at you all the time. And trying to cater to so many young people in one space and make sure that you have all of their best interests at heart. recognizing that sometimes you can't reach them academically until you reach them from a relational standpoint, and just there's so much going on there. So, acknowledging that, I think part of the change we need to make, maybe as a society and a culture, and I'm seeing this happen, is to approach the challenge from a different question. I think we used to ask all the time, like, what's wrong with you? And now I see us moving more and more into the space of what happened to you. And I think when you start with that, you open the door to a conversation. And it doesn't mean everybody needs therapy or you need to unpack that so deeply, but sometimes you can get to a point of there's something at home, or there's bullying, or there's stress, and that the behavior that we're seeing is the outward manifestation of that, right? So I think that's something that sometimes the data doesn't get to. And from there, we can get to a space of engagement, of support, of understanding like what restoration and rehabilitation means. Doesn't mean that there don't need to be consequences for actions, but that's I think something that sometimes the data doesn't quite capture, and something that I'm seeing schools and really society come to, but I think we need to get there a little faster.
Thank you. And this is a thread I want to pull on a bit more. Dr. Doe, what might you add from your work and vantage point?
Yeah, I definitely echo what Dr. Sood has said. It's really important to kind of reframe what challenging behaviors like acting out in class. Um, Not just from focusing on it as a simple kind of misbehavior to be punished, but often it's a signal of stress or unmet mental health or social needs or even difficulty with self-regulation. We know from neuroscience that the developing brain is really sensitive to social experiences, both supportive and harmful, and behaviors like aggression can often reflect a child's kind of nervous system responding to threat or uncertainty. When schools rely on these kind of exclusionary disciplinary practices, the data might show fewer behavioral problems in the short term, but it doesn't really capture what's happening inside the child's brain or body. That might be heightened stress responses to something going on at home, as Dr. Seed said, trouble learning or focusing, or even a lower sense of safety or belonging. And these effects can really ripple forward, shaping how students and young people engage socially and academically even after the incident. So it's really important to kind of reframe behavior as communication of what the underlying need is, rather than just a problem to be punished. And I think that's really key for supporting both learning and mental health and behavioral health outcomes.
Thank you both. And then I'm going to stick with you, Dr. Doe, for this next question. And again, we're going to put these questions in the chat so that folks that are following along and trying to understand what the response is to that. It's a mouthful for me, so I want to make sure y'all know what we're responding to here. But Dr. Doe, so what role does belonging and inclusion play in both preventing harm and then also repairing it after something goes wrong? And then the second piece to that is, where have you seen restorative approaches function most powerfully as a behavioral health intervention, not just as a discipline strategy?
Yeah, thank you for that really important question. I think belonging is essential for students and young people to thrive socially, emotionally, academically. Research shows that supportive relationships with caring adults in childhood and in adolescence predict better mental health, stronger stress regulation and emotion regulation, and healthier adult relationships. We know that adolescents, kind of thinking ages 10 to 25, is this time when our brains are reshaping themselves in a way that's especially tuned for bonding and social connection. But at the same time, experiences of social rejection, like being excluded from friends or school activities, has been shown to activate many of the same brain regions as physical pain. And so students with learning differences or disabilities, or even those from marginalized backgrounds, are often at higher risk of exclusion, whether that's from peers through bullying, or from adults through disciplinary school practices. And we know that feeling excluded isn't a small thing. It shapes how a student's brain responds, how they experience a sense of safety, and then how they engage with the world around them. And so I think for prevention, fostering a sense of belonging for all students makes a real difference. When adults consistently support students, recognize their strengths, and create opportunities that honor their student voice and participation, I think that really helps students feel seen and safe. They're less likely to act out or withdraw, more likely to seek help, and more resilient in the face of challenges. And then when harm does happen, I think it's important, kind of earlier, remembering that behaviors like aggression are often signals of stress or unmet needs. And so approaches that really center connection and accountability, like acknowledging students' experiences, helping them understand the impact of their behavior, and guiding repair of relationships, really gives students a chance to practice empathy, perspective taking, emotion regulation, all of these skills that they need to build to really support long-term health. So I think connection both prevents harm and makes repair possible. And it's important for schools and communities to kind of embed that into daily practice, so they don't just reduce conflict, but they're also actively supporting young people's development and their mental and behavioral health.
Thank you, Dr. Dome. Before I go to this next question for Dr. Massa, I want to stick on this for another quick minute. Dr. Sood, from the clinical lens, does that match what you are seeing?
Oh, 100%. Yeah, no, I think Dr. Doe laid that out really well. I mean, there's one study that I often cite that shows that when a teacher leaves a note on a kid's piece of homework that says, "I believe in you, and I have high expectations of you, and I think you can do better," the kid actually has a higher chance of trying harder and voluntarily revising their work. So like belonging is a prerequisite really to full engagement academically, attendance wise. I think I've done that in meetings, right? Like if I don't feel like that's my space, I sit in the back more and I'm just much more passive, I think. But being welcomed into that space makes me feel like, all right, I can engage. I've been given some liberty to my thoughts. If it's all right, I do actually want to pass to Dr. Massa on this question. I've worked with him for several years now. I know his background. He's been in the schools, both as an administrator and really working with youth on this very topic. So, Michael, if it's all right, I'd love to hear your thoughts here too.
Absolutely. Thank you so much. And thank you again for having me here. I just want to identify first and foremost that I come to this work as a special education teacher. That's how I got into the juvenile justice space. Unfortunately, I learned that so many of my students in the classroom were also involved in the juvenile justice system. And through working with them, it just really activated my advocacy around representing for my kids. And, you know, I want to just frame my response from my perspective and understanding of education systems in a historical context in this country, that they were always designed to be exclusionary, right? This was a commodity that was protected with full force, that was never intended for universal access. And we see that legacy today, right? We see the anti-literacy laws, we saw Jim Crow, and just how hard it is to get all students into a classroom, right? Like we can't ignore that. So when we see suspensions and the different ed code around what you can suspend for and what you can't, it's just a recycling of this same essence that this commodity was not designed for universal access. And that's what lit the fire for me, because I needed education to create pathways for myself and thought, okay, perfect. Here's the answer. Let's get every student to engage in that. And then I saw that they weren't able to. And when we started to see these exclusionary discipline practices lead into juvenile justice involvement, dropping out, and looking at the history of a city like Los Angeles with the second largest school district, where you see that graduation class, 50% of what it started when they were all ninth graders, we have a critical crisis that we don't respond with that same essence and alarm. So that sense of belonging is so critical. And I just want to answer this from my work in a juvenile court school. these kids were remanded to detention in lockdown facilities under the supervision of probation departments. Yet the absence rates and the suspension rates are higher than the state average. And it almost seems like an oxymoron. How can these kids in detention settings not have access? And again, it's this legacy of who was this commodity designed for, and why is it so hard, even for young people in detention, to access this resource? And so I just don't want to lose sight of that historical context, because this isn't new. The school to prison pipeline was named something else 20 years ago and 100 years before that. So our work now, I think, needs to not just dismantling the school to prison pipeline, but re-engineering it so that we truly work towards the equity of making education accessible for everyone, so we can really maintain that sense of belonging.
Dr. Massa, well, let's just stick right there then. So from a youth justice and reentry perspective, what does accountability look like without exclusion? And then the ancillary pieces to that question is, how can schools support students returning from more restrictive settings in ways that promote responsibility, healing, and reintegration?
I think this is the challenge that we have at really examining our classrooms, right? How do we reimagine these spaces so that we're not looking at this? And I'll give my example, right? I was out of college. I was getting my credential. I was hired on an emergency credential, meaning I was a special ed teacher working on my credential at night. I was in a school with 4,700 kids. There was 3 different tracks. 3,000 students were supposed to be able to eat lunch in 30 minutes, right? Like, this is just the chaotic scene. And it was funny because I have that reality, and then I'm going to my credential classes at night that are reinforcing, oh, kids with IEPs are the most protected. They have these federal laws that ensure that they get all this amazing support, all these elements of pedagogy that's really going to be the catalyst to their academic success. And then I'm in my classroom and I'm working with kids who are in and out of juvenile hall, getting suspended on a regular basis. And I'm just thinking, like, how is this incongruence makes this impossible? Yet we put the burden on the kids and we chastise them and their families and make them feel less than, because they weren't meeting this mythical expectation. And so that really became my challenge, right? How do I work with my kids so that when I see their behaviors that would have otherwise gotten them into trouble, to readjust my mindset, to recognize that as communication, they're telling me I need help, right? And so instead of suspensions, it became, hey, what's going on? Let's talk. Do I need to just sit with you during lunch? Do you need to come to the classroom so we could have a safe space to have these conversations? And just getting to know the kids. And I eventually became a principal at the juvenile court school in Los Angeles. And I would make sure to go every day to every classroom and say hello to every kid. The kids were coming in and out every day. There were so many kids that wouldn't know me. They were like, who's this weird guy saying hello to me? And the rest of the kids would tell, oh, no, he's cool. Don't worry about it. But just that simple act created and level setted an environment where now these kids knew that there was at least one trusting adult that was going to see them on a daily basis. And that was enough to make a difference. And I don't say that to promote what I was doing, but how sad was it that so many kids in Los Angeles, one of the greatest cities in the world, don't have one adult in their lives that cares about them. Yet we want them to focus on algebra. We want them to write those 5-paragraph essays. Like, we have to really adjust our thinking and not put all the pressure on the teachers to be able to solve all these issues. And why does it have to be one adult in the classroom? Why couldn't we have the teacher to master instruction and deliver that content, but also have a social emotional coach, someone from the community, a college student? These classroom spaces really need to be bastions of success that our students can see themselves in, and not just places where they're being told they're special ed, they can't read. better you throw a desk so that it doesn't expose your lack of academic progress. That's where we have to hold ourselves accountable and stop looking at the kids as the problem.
Yep. No, I would just double click on, well, first of all, everything you just said, Dr. Massa, but we frame this so much as a young person, a student, a kid problem. And this is from, I'm speaking to myself here as a previous educator, classroom teacher. I was probably the bigger problem, and systemically just trying to have this kind of power over, this is my classroom, this is my room, this is my game, and you're in it and you're going to follow the rules here. And you know, it was many moons ago, but reflecting on those years and understanding that this isn't letting kids off the hook. And that is, I think, the biggest pushback. This isn't not holding kids accountable. You're holding young people accountable. You're holding adults accountable. And in parallel, we're learning skills as adults and as young people to understand how to resolve these situations, how to not resort to whatever activities, whatever actions got us into that restorative conversation. So thank you so much, Dr. Massa. So we'll move to our next question here for Dr. Sood. At a system-wide level, what does it actually take to shift from a system and approach of removal to connection? And then where do schools tend to overestimate what one person or program can do without broader system alignment?
Yeah, the systems certainly need to align. I think, and when I say systems, I want to make sure that it's clear where we should think more expansively than the education system in and of itself, right? For services to be effectively administered, it cannot fall to one agency or one sector, or one set of resources. Dr. Massa, his office, right? Like we need to pull in those that are in the juvenile justice space. We need to pull in folks in the child welfare space, in the behavioral health space, in the more general healthcare space, into this single ecosystem that really thinks about centering that young person who may be interacting with these different spaces all, over the course of their single being. To some, they're a healthcare member, to others, they're a patient, to others, they're a student. They're really just one human young person. And so in terms of how to get there, we're trying to build that out. Where the initiative that I direct, the Children and Youth Behavioral Health Initiative, is really partnering with the community schools effort led by the Department of Education and many other partners out there in a work that we call Transforming Together. To understand that community schools pillar of integrated family supports, and thinking about some of the child welfare work that already has a good basis upon which we can think more comprehensively about service delivery through interagency leadership teams, right? Through sharing data, through sharing financing, through thinking about a universal array of systems. So happy to put that link in the chat about a specific guidebook, an implementation guidebook with tangible tools and implementation steps we can think through to align the system such that we can deliver more services, and in particular where kids are, right? So they're at schools, but all of these other sectors can really work together to ensure that it's not just on the education system to think through the services and supports for a child.
And Dr. Sood, so sticking on that, where do you see underused policy or funding opportunities that could meaningfully reduce the negative outcomes that we're seeing?
There's so much that we've been trying to build over the past few years. That to me, everything's underutilized unless everyone utilizes it. But I can respect the fact that there's competing priorities. There's a lot on people's plates. So I'll put it more out there, as a menu. So, for those on the call, if it's professional development that you're looking for, right? If it's training for your adults in your space, just like both Michaels on this call mentioned, right? Like the schools or the education systems themselves and the adults in that space set the culture. So if we're looking to transform that culture and you want more training in healing-centered practices, there's a training called Safe Spaces that's out there. And again, we'll put all these links in the chat, make sure you have access to them. Everything I'm about to mention is free. There's also additional trainings that we've set up to explore and have folks really understand some of these concepts of restorative justice. And both of these trainings, that one's called Open Doors. Both of these trainings exist as online modules, but they are moving also into the train the trainer space. So you can bring them to your schools, have one champion kind of get caught up to speed, and then have a great local conversation about what that looks like. So that's training, right? If you're looking for new staffing models, through this initiative, we've codified a new position in the state of California. Dr. Massa just said, like, why can't we have students, social emotional learning coaches in the classroom? That's what we're trying to build up. They're called certified wellness coaches. And they may already exist on your campus, right? Different schools call them different names, technicians, liaisons, et cetera. But these are folks who can be that person who's not really tethered to a caseload, who's junior in their career ladder, so will need some supervision from a licensed personnel, but they can go through one-on-one sessions with a kid and help with some emotional regulation, some coaching aspects, even some care navigation aspects to make sure they're getting to the right space for the right support that they need. So certified wellness coaches is another piece to check out. If it's messaging, we've got campaigns on adverse childhood experiences, on suicide prevention, on reducing stigma in languages and cultures that are available throughout the state. So happy to share more and make sure schools have access to those types of resources. If it's services, if it's sustaining services, right, we've got new billing programs and financing mechanisms for that to happen called the CYBHI fee schedule. All of these are new. So all of these are getting up and off the ground in terms of engagement and utilization, but there's still a long way to go.
Thank you. Thank you, Dr. Sood. And so we'll wrap up with this last question and we'll start with Dr. Kathy Doe. So what can be done now? If a district or a school wanted to start shifting practice in the next, let's say 30 to 60 days, what is one concrete step they could take? And then what's a signal they could look for that tells them that the shift is actually happening?
Yeah, I'm going to just build off of what Dr. Sood and Dr. Massa highlighted, which is kind of the power of connecting students with caring adults. And so, one concrete way schools could take right away is to create more regular or structured opportunities for students to connect with adults through like brief check-ins or mentoring moments. And then I think a shift to pay attention to know that schools are kind of intentionally looking for, or a shift, I think, is real when schools intentionally look for changes that kind of show students are feeling more supported, feeling less stress and staying engaged. So not just focusing on fewer disciplinary referrals or behavioral problems, but really paying attention to these broader school climate and student outcomes that help ensure that the school practices are actually improving student well-being and a sense of belonging, rather than just kind of changing labels or language.
And then I pose the same question. Thank you, Dr. Doe, to Dr. Massa or Dr. Sood.
Thank you. I was a dean of discipline at a high school in Los Angeles. And, the first year we had like over 600 suspensions. Second year, it was like 400 suspensions. And I really wanted to address that because I felt just making school inaccessible to students wasn't going to do anything for them. So we just committed, a group of us got together and said, we're not going to suspend. We looked at the ed code. We saw that the overwhelming majority of suspensions are discretionary. So why are we using that discretion to suspend the kids from accessing the school? And we got it down to one suspension for one academic school year. But, and I wish I had a magic pill for it. It was just that we cared. And we told the kids, we're not going to suspend you. If you were smoking weed at school, you were going to go to drug counseling. If you got into a fight, you were going to go to anger management. And it got to the point where the kids were like, come on, Masa, just suspend me already, man. I don't want to do all of that. And it was like, no, like I care too much about you. I want to see you tomorrow. I'm not going to just brush you away. You're my student and I'm going to honor that. And I think, we can use all the acronyms in the world, institute, whatever programs, but if we don't care about our kids, they're not going to do well. And that's what we just really need to commit ourselves to.
I don't know if I had much to add, if I'm honest. That was beautiful. If you zoom out from what Dr. Massa just said, I would say the same thing, which is like start with the data, which is what he did, right? Started by looking at the suspensions and the expulsions, and then have some open and honest conversations with staff, with students, with families, develop the plan, like Dr. Massa just described as a perfect example of that. And let's hold ourselves to account here.
Thank you all. Dr. Massa, you kind of had me choked up a little bit, just like it's not crazy. It's not this like mythical theoretical framework. It's just sometimes it's just caring. All right, so before I drop a tear, there's some great Q&A questions. Again, we had like over 50 questions from folks registering. Thank you so much for taking the time to do that. That really helped inform this conversation right now. And then we had a couple that have come in that we want to make sure we address. So this is going to be for anyone on the panel here. So implementing consistent support structures requires changing the school culture to allow for sustained practices, which creates tension with the sense of urgency that many schools are feeling. So here comes the question. How would you strike a balance between these two conflicting realities with the goal of changing how students experience learning?
I can jump in if anyone else wants to. So yes, okay. My training always reinforced, oh, to change school culture, it takes 5 years, and gave this like arbitrary timeline, right? And I just remember being frustrated, especially when I was a principal at a juvenile court school with the culture, right? It was about the adults, what's best for the adults, and the kids just did not matter. And so to work towards that change to prioritize the young people, it was a cultural shift that was going to be hard. But what I did was there were the few that were vocal and monopolized all the staff meetings and just prioritized their priorities. And I just ignored them. And I worked with that group that was willing to make those changes towards enough of a consensus that we just reverse peer pressure those outliers to make them feel like they weren't the ones that mattered, because they didn't. It was my kids and the adults that cared about them that needed to be the priority, not the loudest ones in the staff meetings, not the ones that wanted to grieve me. I just couldn't put my priority and succumb to the bureaucracy that would take my efforts away from doing what was best for kids. And it's not easy. I get it. I present white, I'm a male, I have all the social capital to be able to take on that. But it was what I needed to do and just forge forward for my kids and just ruffle feathers and not be scared to do that because my kids deserved it.
Yeah, I'll just add that sometimes, systemic change, as you say, takes time and feels like out of reach. And so I think I often try to think of what is within my sphere of influence. It just takes one conversation or one relationship, one time that you're expressing that you care about a student that starts that uh, feeling or that climate of support and a sense of belonging. And so I think also trying to start with the small steps, the ones that are within your influence, would be one way to kind of work on changing the support systems in schools or communities, while at kind of like on a day-to-day basis instead of waiting for kind of systemic changes to happen. So I think about your sphere of influence. You definitely have a huge effect on young people, and young people are often learning from you and looking up to you. So I think remembering that is still powerful. A powerful way to support young people is important.
Thank you both. And then we have another really good question here, kind of focusing on crisis response. So how should schools respond when behavior escalates to aggression or safety threats while still aligning with restorative and behavioral health principles? And I think this one hits because this is what there are situations where there comes a point where educators should not feel unsafe. So I think that's this big tension we're really coming across right now.
I know that it was really important to also do an assessment as school leaders, and we're all leaders in our own respects, right? Whether it be in the classroom or school-wide, systems-wide, to identify those resources that that are the change agents, right? And it's not about titles. And I think we're so driven by this hierarchy of titles and am I allowed to do this or not? And I'll tell you that the biggest changes I was ever able to make was by empowering the teaching assistants and really elevating and honoring their presence. They most often came from the community that my kids lived in. They were the ones that had a rapport that the teachers did not necessarily have. And empowering this resource to really be part of our decision-making process completely changed the culture. And it also really helped the kids understand that if you were going to contribute towards the solution, no matter who you were going to be part of the solution. And I really wanted to make that the culture of the environment that I was in so that everyone had responsibility and a pivotal role so that those who weren't able to contribute into the community in a positive way would then feel like, hold up, like something's wrong here. How do I get down with what's going on in this situation? Because I'm feeling left out. And that really helped work towards that community and that sense of responsibility to contribute to the community in a meaningful way. And, safety is real, and I've been in situations where there has been bodily harm and it's hard to come back from. And it's not easy. And we have to accept that there are situations that aren't easy and there are no magic solutions to this work. But when we don't think someone's watching, those kids are, and they're observant. And it's how we carry ourselves and respond in those really difficult, heavy situations that provide some of the strongest learning that our kids are ever going to have as an opportunity to grow from.
Yeah, I'll just add that I echo everything Dr. Massa just said. I think it is really important that schools prioritize the safety first for the student, peers, staff, whoever it is. And so responses can separate the student from the immediate kind of harm, but you can still maintain connection and support. So, empowering teaching assistants or as Dr. Massa said, or other staff to be equipped with strategies for de-escalation so that you can, structure opportunities afterwards to help students process what happened and understand how their behavior and actions affect others and work on kind of repairing those relationships. And so I think there is this really challenging and delicate balance where you have to prioritize safety first, but you can also, empower adults with the skills that they need to kind of handle the situation, but also, teach skills like emotion regulation, accountability, perspective taking that help to kind of support long-term well-being and social skills rather than just kind of punishing in the moment. So it's a hard balance, but I think, just keeping that in mind is important too.
Thank you, Dr. Doe. And we'll try and get one, possibly two more questions in, but sticking on a little bit what you're talking about, one big challenge this year for across the state was universal TK. And one question that had come through is, what does this look like in a TK through, lower and upper elementary grade? Developmentally, are they able to sit there and really have a restorative conversation, understand what the harm that was caused, or what could it look like now that we're in a space where we have this universal TK, which is wonderful for families that are able to utilize this. how are school leaders, how are classroom educators, paras supposed to, if they want to adopt a restorative approach, tailor it for a young developing mind?
Yeah, that's a great question. I think I think it's important to think of the language and the kind of early social skills that you're going to be trying to target and help develop as an adult, as a leader in schools and communities. And so in this age range where you're in early childhood, TK through 2, kids are just learning how to, make friends for the first time and what behavior is okay, what behavior isn't okay, what their boundaries are socially, physically, and what happens when you cross them, cross others' boundaries. And so I think, adults who pay attention to teaching um, those kind of early social skills, how a young person talks to another student, talks to another adult, are important kind of first steps. You're not worrying as much about different kinds of exclusionary practices or social behaviors that you might see in the teen years, but you want to start small with just fostering more inclusive peer interactions, adult interactions, to foster that sense of belonging early. So I think that might be a kind of early way, but admittedly, my kind of background is more in the teen years, so I am yeah, I can only say so much about the early childhood years.
I could jump in with just a really quick story about this. I was working in a school setting, and there was a TK teacher that was really struggling with a particular student. And I'll never forget having this conversation, like, explain to me what's going on. And the teacher was, just had a list of complaints and ultimately was like, they're just so much more immature than the rest of the kids. And I was like, hold up, like, we're talking about like these little babies. Like, what do you mean? Like, who's mature at that age, right? And it turned out that this student just had a lot of energy. And so we just like socially constructed these opportunities to just exhaust the student. Like, oh, I bet you can't run to that side of the field and back in this much time. And she loved the challenge and would try, and we're like, nah, you could do better. And we would just wear her out until she got back to the classroom, was just so tired that she would sit there. It helped her focus. And we didn't have to talk about special ed for a TK student. We didn't have to talk about a 504 plan yet. Like, they're kids, and sometimes we're so caught in the job that we lose sight of that. And I don't say that critically of teachers, because there's so much pressure to get your scores in, make sure that your notes to the parents are up to date. There's just all this administrative work that just gets in the way of being teachers. And so sometimes it's just having the support to be free to think a little bit outside the box.
Yeah, absolutely. Well, thank you both. I just want to give you space to close out with any last things you'd like to say for the folks that were able to hang around and join us today.
Please, Dr. Doe.
I was gonna say, please, you go ahead. I think a lot of our responses lately have really, focused on empowering and supporting adults in schools and communities to be the change, whether that's in small everyday moments, everyday interactions with young people, or in implementing, systems level, school-wide level support so that every student feels safe and supported and able to learn and, live a healthy, happy life. And so I think just remember that you have a lot of power as an adult in these spaces, and that young people are very impressionable and eager to learn from you as role models.
And I just want to add that what I've learned over my time is young people who are exhibiting the most extreme behaviors are often doing so because of the unhealthy adults around them. And let's not lose sight of the fact that behavior is a form of communication, and those loud cries for help are supposed to be responded with help, not, I don't want anything to do with you. And so when we find ourselves in these situations, again, we can't do it all, right? Don't be scared to ask for help. Find those trusted partners, those administrators, those peers. Sometimes it's the, you know, cafeteria people, the janitor. Like, get creative in who your source for help is, because there are those that will be able to make those connections that you may not be able to right then and there, but it's going to be respected that you went above and beyond to try to make that connection. And those relationships are the ones, those students that frustrate you the most at first are the ones you'll never forget about. And just don't give up on them right away, because they're beautiful, they're amazing. And with the proper nurturing, they thrive. And to watch that happen as us as educators, there's nothing that means more than that. So please, they're all our kids, and we just have to be committed to that.
Thank you both. And I know Dr. Sood's not here, but thank you to Dr. Sood. When we catch up again, thank you all for just spending this afternoon with us. I mean, there's so many things that you all are doing from your work, parenthood, community members, coaches, and just thank you for being engaged in this work. And with that, we'll close out. We have a survey that will likely come to your inbox. I think we'll also be able to put it here in the webinar chat. And just to the extent you have the energy and capacity, like, let us know. Like, it's our job as researchers, as advocates, as clinicians, to provide you all with the things you all need and advocate for them, both locally and at a legislative level. So the more that we have that feedback and understanding, the better we can gear the things we do, the products, the objectives, the packages, to address what you all are needing and looking for. So thank you all. I appreciate your time so much. Dr. Doe, Dr. Massa, thank you both.